Hello, I'm Jessica Coburn, a member of the WNA Public Policy Council. Today, I'll be guiding you through how to prepare your students for Nurses Day at the Capitol. Welcome. Thank you for supporting your students' knowledge in the importance of legislation. At Nurses Day, students will learn how to engage with their legislators, expand their knowledge of the political process, and understand the importance of supporting legislative policies that benefit nurses and patients. For more information on any of this, please visit us at the Nurses Day at the Capitol website. The purpose of Nurses Day at the Capitol is to assemble RNs in person to learn about the state legislative issues pertaining to nursing practice, education, and healthcare delivery. It's also an opportunity for networking, learning advocacy skills, increasing the visibility and voice of Wisconsin RNs, and advocating for bills that improve outcomes for nursing practice, education, and healthcare delivery. Advocacy is a key competency for RN students. This experience allows for the exploration of advocacy at a broader level, a state level. Awareness of state and national policy issues improves students' skills in advocacy, their ability to discuss policy issues with legislators, and their leadership skills. Advocacy, according to the AACN New Essentials, is the act or process of supporting a cause or proposal. It's a pillar of nursing, and legislative and political advocacy is equally important to advancing patient care. Here is a list of the entry-level professional nursing education competencies related to Nurses Day at the Capitol. You'll see they're listed by competency and then a description of the competency. They include such things as describing the policy development process, engaging in professional activities or professional organizations, recognizing the importance of nursing's contribution, and looking at evaluating the effectiveness of advocacy actions. Here's our agenda for the morning of Nurses Day. Arrival starts at 7:15 until 8:15 when the welcome begins. Registration happens first. There's a continental breakfast and there's an exhibit hall. By 8:15, everyone should be seated in the ballroom for the overview of the day, followed by the keynote. And then there are some other talks throughout the morning pertaining to legislative visits, what our priorities are at WNA for legislation, a break to visit the exhibit hall again, and then the morning program will be done by noon. In the afternoon, we will have scheduled meetings with our legislators at the Capitol building. So there will be a floor plan to help you get around the Capitol. It's about 2 blocks away from the Monona Terrace where the morning events are scheduled. And WNA will schedule the meetings with the legislators when you and your students register for Nurses Day. After meeting with the legislators, which you'll receive that schedule on or before the day of Nurses Day with office numbers and times and who you're meeting with. After the meetings, you can debrief on the meetings in our WNA hearing room. That room number is to be determined. And there you will find WNA volunteers assisting in the debriefing, kind of what happened, how did it go, what did you think of your meeting? A report form, just telling WNA kind of those same things. How did your meeting go? And receiving a certificate of attendance, which can be used to verify participation for your students. if you can't make it with them. So another thing to know is that there are going to be 3 legislative priorities talked about this year at Nurses Day. And the legislative priorities are set by the WNA Public Policy Council, together with the executive director, based on what our most important pieces of legislation might be for the coming biennium. So this year, the priorities as determined by Public Policy Council are the licensure and independent practice for APRNs, otherwise known as the APRN Modernization Act. This will be familiar for those of you who have gone to Nurses Day the last couple of years. This bill is starting over again after being vetoed last year for the second time. Number 2, tax credits for nurse preceptors. This is a piece of legislation that we're hoping will be introduced this year. It's a tax credit for preceptors who take on both undergraduate nursing students as well as DNP nurse practitioner students. And 3, advocating for the Wisconsin Nursing Education Loan Forgiveness Program. That's been an ongoing program, and we would like to keep it in the budget to mitigate the bottleneck holding up nursing education, which is not enough educators. So you will hear more about all 3 of these priorities at Nurses Day. I wanted to provide a sample reflection assignment. So this is a good example of how you can have your students reflect on Nurses Day after the fact, either in a post-conference or as a written assignment. So just looking at how they can identify a state or federal policy, and I always point out to them, not a hospital policy or a systems policy, because we have plenty of those too. And sometimes that is a point of confusion for students, that has impacted the health of your patients, yourself, or a loved one. So then explaining how this legislation has impacted that person and asking them to think about how they feel, adding the nursing perspective to the legislative process could impact these outcomes. So why is it important that nurses have a voice? I've included a sample rubric, if this is a written assignment, that you can feel free to use or modify. Thank you so much for listening. We will see you at Nurses Day at the Capitol. I hope this brief overview gave you a couple of ideas for how to prepare your students for Nurses Day at the Capitol.